Well, the government next year is going to reduce overall health spending in net terms by about €543 million. However, in reality, the HSE is still going to be spending in excess of €13,000 million on health service next year, but there will be some significant changes in relation, significant policy changes in this area, as we know at the moment. Perhaps the headline issues we're going to see is the government will move to make its first steps towards the introduction of free GP care, and it will be implemented. Money is being made available for the establishment of free GP care for people who are covered by the long-term illness scheme. Now, that was flagged a couple of weeks ago by the Minister of State, Roisin Shortall, but it was announced formally by the government this afternoon, and about €15 million has been given to that, and we'll know more details later on in relation to how that will actually go to work. However, in relation to cuts, we can expect quite significant changes or significant implications for the 2 million people who are covered by private health insurance. The government is going to seek to make savings of somewhere in the region of €146 million through changes to the way public beds are funded in private hospitals, or private beds are funded in public hospitals. We're going to see an increase in the rate that will probably generate about €18 million, and then it is going to change the rules in relation to the way private beds or beds in public hospitals are specifically designated for private or fee-paying patients. At the moment, about 20% of beds in public hospitals are earmarked for private patients. That's going to change. It is going to have significant implications for the health insurance companies, and as we've seen before, those measures will inevitably lead to quite significant hikes in the health insurance cover in the year ahead. Given that we have nearly 2 million people covered by private health insurance, any measures that leads to substantial further hikes in private health insurance will hit hard. We'll also see at the moment thresholds for people qualifying for refunds or subsidies under the drug payment schemes are going to increase from €120 per month to €132 per month. So again, that will hit people who are not covered by medical cards. However, on the plus side, the warnings that have been given by Minister James Riley several weeks ago in relation to charges for medical card patients, they are not being implemented. So good news for medical card patients, not so good news for people covered by private health insurance.